This video provides instructions for how to complete a plan of care. The plan of care is the clinical plan for care. The plan of care is a reflection of thoughtful clinical recommendation of services needed after communication with the patient, the caregiver, or family about the needs and treatment plan options. It also drives authorization requests, therapy service delivery, and is the benchmark to which the delivery of services is held regarding compliance. It is a legally binding document that reflects your commitment to your patient, the physician who signed the order for services, and to the funding source that will pay for the medically necessary services. Because of the critical nature of the plan of care for all aspects of clinical service delivery, there are a number of compliance and programming rules built into ACE to prevent accidental non-compliance. Let's take a look at those compliance tools now. A plan of care can be written for a maximum period of 6 months. The duration can be as short as clinically appropriate, but no longer than 6 months. A plan of care can be updated in ACE at any time, as frequently as necessary. 2 weeks prior to the expiration of the plan of care for any active patient, the user will receive both an inbox message and a scrolling alert message to remind them that a new plan of care will soon be due. The inbox message will include the next evaluation due date for the patient, so that the clinical user can schedule and document a new evaluation prior to the plan of care expiration if clinically appropriate. There are 3 ways that the plan of care in ACE has unique superpowers. 1, it's the only place where new goals can be added. 2, it's the only place in ACE where short-term goals can be marked as met. And 3, it's the only place in ACE where short-term goals can be discontinued. This means that prior to completing your authorization questionnaires for the patient's funding source, you may first need to update the plan of care so that the met and discontinued goals will be indicated. We'll talk more about authorization questionnaires later. Because the plan of care is a legally binding document, when critical information about the patient's therapy plan changes, it's imperative that the clinical user update the plan of care. For instance, if your plan of care is for 2 visits per week for 30 minutes, and then the parent requests a change to 1 visit per week for 45 minutes, then the plan of care has changed. In order to remain compliant, the clinical user will need to update the plan of care. Another example of when a plan of care is required is when the patient has a new evaluation. Evaluations are the only manner in which a patient's clinical diagnoses or severity rating may be changed. If either the clinical diagnosis or the severity rating for the patient changes with a new evaluation, a new plan of care is also needed. Updating a plan of care is quite simple in ACE. ACE only recognizes 1 current signed plan of care. The plan of care is the document that covers services delivered during the plan of care begin and end dates. Thus, all services delivered that fall within the plan of care dates should be documented and signed before a new plan of care is written. Check the ACE schedule for undocumented or unsynced visits for a patient prior to signing a new plan of care. You can also utilize the Scheduled Undocumented Visit Report in ACE to verify completion of documentation. A plan of care is initiated by tapping the Plan of Care button from the Documentation tab of a patient record. A plan of care can also be created by continuing through the forms at the time of the evaluation. No matter how you gain access to the plan of care forms in ACE, via the evaluation or from the plan of care button on the Documentation tab of the patient record, one thing is certain: you must complete the documentation from beginning to end in one session. ACE will auto-populate the current date as the start date of the plan of care. However, this date will change to the date of the clinician's signature because a plan of care is not valid until it is signed. The plan of care start date cannot be a past date. The end date will auto-populate 6 months forward from the start date. A clinical user can adjust the date by tapping on the blue calendar button. A calendar will open, allowing the user to adjust the end date to less than a 6-month time period, but no more. A plan of care is valid for up to a maximum of 6 months. ACE will next show the clinical user the clinically recommended services from the evaluation. The user will determine if they're going to provide the exact services that were recommended in the evaluation, or if they wish to provide services that deviate from those recommendations. In this example, if you were not going to provide therapy services 2 times per week, then you would tap the No button. By tapping No, ACE allows the user to enter the actual frequency and duration of services that will be provided to the patient. This is done by means of drop-down boxes. The clinical user will also identify the rationale for the adjusted service delivery plan. Once all information is entered, tap the Continue button. Here is an example where the services to be provided deviate from the recommended services due to following the frequency identified on the IFSP. ACE will show a visual of the clinical diagnosis for each area diagnosed so that the clinician can determine the area of intervention. If the patient has multiple disorders and areas of intervention, the clinician can choose not to work in a specific area by providing rationale as to why that area will not be addressed in therapy services during this plan of care. For areas of intervention to be targeted, the user will tap the text box to enter the long-term goal for the patient. When you find that you want to create language or fluency goals for a patient, you must remember that in order to target language or fluency or any other area of intervention, the patient would need to have that type of evaluation to diagnose the presence of that specific disorder type. And then ACE will allow for the creation of a plan of care to target those skills. The very first time a plan of care is created for a patient, the short-term goal form will be blank. To add a short-term goal, tap the Add Goal button. The clinical user will write short-term goals in the provided text boxes that include the goal, the current level of the goal, and the duration in either weeks or months. To continue adding goals, simply tap the Add Goal button. To remove a goal that you've written, tap the Remove button. Once you are satisfied with the short-term goals for this plan of care, tap the Continue button. Let's take a moment to look at the short-term goals when it's a subsequent plan of care. ACE will show you the goals from the previous plan of care, and the clinical user will work from left to right, top to bottom, addressing the old goals, and then tapping Add Goal to add any new goals to this plan of care. When you want to continue a goal into the next plan of care, tap Continue, enter the current level, duration, and then click Yes or No if progress was made. If you want to discontinue a goal, tap Discontinue, enter the current level, and then check Yes or No if progress was made. When a goal is met, simply tap Met, and there is no need to address any other column in ACE. ACE will then show a list of skilled interventions that you can choose to target in the patient's short-term goals. ACE does not limit your choice of skilled interventions, but you should select meaningful and appropriate skilled interventions. ACE will only allow you to choose skilled interventions that are clinically appropriate for the area of intervention targeted for the patient. When you are unfamiliar with a specific skilled intervention, you can tap the blue question mark. A description of the intervention will open, along with a methodology for the intervention as it was used in the EBR citation. Additionally, a summary list of the skilled interventions you identify for each patient will appear on the printed plan of care, including the name, a brief summary, and the clinical citation. There are certain skilled interventions that are used so frequently by clinicians that they are pre-selected in ACE. The user may unselect them if they will not be used with a specific patient, or the user may add their own skilled intervention. The clinical user will identify the anticipated prognosis toward meeting the clinical goals identified on this plan of care. The next form in the plan of care is for general comments. This form is a free text box where the user can enter any information that needs to be written about the plan of care that is beyond the information provided in ACE. Why are you writing the plan of care? Is it the patient's initial plan of care? Is this a subsequent plan of care? Are you writing this plan of care because you're increasing the frequency or decreasing the frequency? Why are you writing the plan of care? Documenting the purpose of this plan of care is helpful to the clinical supervisor during the ACE review process, but it is also helpful in documenting the clinical story of the patient. ACE next provides an opportunity to review the documentation and make sure that there are no typing errors and that your goals are clinically appropriate and medically necessary. Do you have the correct frequency identified? Once you are satisfied with the document, tap the Continue button. Once you are finished with your document and the review requirement is on, you will tap Yes, Submit for review. ACE will alert you that your document has been submitted for clinical review and will be returned once the review is completed. And always remember to sync your data. When the review requirement is turned off, you have the choice to submit for review or sign the POC without review. When you are satisfied with the document, tap the Sign POC without review button. The attestation and signature form will open. Note that the attestation and signature on the form is the clinical user's commitment to the legally binding document that is the plan of care. Your signature on the plan of care attests that the plan of care is a valid clinical representation of the skilled services needed to remediate a diagnosed disorder, that the goals are clinically appropriate and necessary for functional communication or swallowing. Recommended services will be delivered using skilled clinical intervention approaches that are well documented in evidence-based research, and that the recommended POC is clinically appropriate, medically necessary, and requires the skilled intervention of a licensed speech-language pathologist. When you are satisfied that all statements are true in regard to the plan of care you have just written, click the Sign Plan of Care button. The password box will appear, and the user will enter the password that is the same for the login to ACE. The user will then tap the Sign Plan of Care button. ACE will provide you with an alert message that the document has been signed and filed in the patient's EMR. From that moment forward, this plan of care is in place, and any former plan of care for the patient is invalid. To change goals, discontinue goals, mark goals as met, change the frequency, or any other specific detail noted on the plan of care, a new plan of care must be written. This concludes the plan of care documentation instructions for ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.